Again, welcome everybody. Just gonna start in about another 2 or 3 minutes to just allow everybody to join us, okay? Okay. Eileen. So these Wellness Wednesday is in partnership with the Brooklyn Borough President. We want to thank them a lot for this initiative. And also we want to thank the Alzheimer's Association for providing this important topic for us today.
Greetings. I'm Brooklyn Borough President Eric Adams. It is my pleasure to welcome you to the Wellness Series for Caregivers, a collaboration between my office and the PSS Circle of Care. I do not believe we can do enough for the caregivers in our homes and in our communities. Most of them will humbly say that they do it out of love or concern, but caregiving can take a toll on a person's emotional, physical, and mental well-being. Studies show that family caregivers often carry a great deal of stress, and many neglect their own well-being in favor of meeting their caregiving responsibilities. With this in mind, it is imperative that Brooklynites be provided with relevant information and tools that educate and support. During this series, many important issues will be covered, such as basic caregiving, elder law, mindfulness and meditation, COVID-19, and understanding dementia. Although the subjects are serious, we hope you find the presentations engaging and light, with the goal of providing you with the tools and strategies for effective caregiving. And as you learn and engage, hopefully you'll do it in an environment that lets you know that you are not alone. Thank you for your selfless caring and support. Please enjoy the series.
Again, it's a pleasure to work with the Brooklyn Borough President to provide important topics that can help and then also resources to the community. Again, let's see, we have a few more people. So again, everybody, the presentation is being recorded. If you miss any part of it, it will be posted on our website, pssusa.org/resources. I'll put it in the chat. Like if you miss any part of it, you can go, and other ones that we had for the past 3 weeks, so you can see them there also. Without further ado, I want to introduce you from Greg Draken. He has provided a variety of different healthcare settings devoted to help people with various health conditions. Since joining the Alzheimer's Association in October 2017, Greg delivers programs and services to individuals affected by dementia. His experience in the community health and health promotion has allowed him to deliver programs in various communities across New York City. And today's webinar is about COVID-19 and caregiving. So this is a 1-hour presentation where Greg going to give practical tips for Alzheimer's and dementia caregiver. Without further ado, Greg, you can start now.
Thank you so much, Shayna. Thank you for the opportunity to come and present today. I hope you're all doing well, staying safe and healthy. And this is such an honor to be able to do this. So I thank you all so very much. So I'm going to go ahead and share my screen. So I hope you can all see that. Let me just, there we go. Hope you can all see the title screen, COVID-19 and Caregiving. That's
I can see it. That's great.
Perfect. Thank you. That's our program today. So like Shayna mentioned, my name is Greg, and I work as a care and support program manager in the New York City chapter of the Alzheimer's Association. So before I get started with the program today, I want to talk a little bit about the programs and services and what we're doing here at the Alzheimer's Association. So we are a large national organization. We have chapters all across the country, and we provide a variety of different programs and services to individuals affected by all forms of dementia, starting with our core services, which include our helpline, which is available 24 hours a day, 7 days a week, 365 days a year. The number is 1-800-272-3900. That's the number you call if you have questions about dementia, memory loss, if you want to learn more. It's also the number you call to register for our programs and services. And I always tell caregivers that's the number you call if you are noticing that your loved one is anxious or agitated. It's 2 o'clock in the morning, perhaps, and you're noticing those two common dementia-related behaviors. The helpline is staffed by licensed clinical social workers and counselors who are available to assist at all times. So really wonderful resource. And then here locally in New York City, we provide education programs for members of the general public, such as our 10 warning signs program, our Healthy Living for Your Brain and Body program. We also have programs for caregivers, such as understanding and responding to dementia-related behaviors, effective communication strategies. Another program is Understanding Alzheimer's and Dementia, where we talk about the science behind the disease and disease progression. Living with Alzheimer's is a 3-part series we offer for the early stage, the middle stage, and the late stage, where we talk about issues that caregivers commonly encounter. And then last but not least, another wonderful program, Dementia Conversations, where we talk about how to initiate conversations that oftentimes can be quite challenging. And of course, COVID-19 and caregiving that I'm offering today, as well as another program called What Every Caregiver Needs to Know. We also have caregiver support groups in addition to our education. That's a wonderful opportunity for caregivers to get connected to one another, to learn from one another, gain valuable information. We offer them throughout New York City. And then we provide care consultations, so you can meet with myself or anyone else on the team to really address your unique situation virtually, of course, right now as a result of COVID-19, but hopefully returning to in-person soon. And then last but certainly not least, our social engagement programs for individuals in the early stage of the disease. We have support groups, and we also have activities to help keep them engaged. We know how important that is to offset a lot of the behavioral changes associated with dementia. So all of our programs are free, offered all throughout New York City virtually for now. And in my role as a care and support program manager, I bring these programs to the communities of New York City. So I provide education programs for caregivers, members of the general public. I also provide trainings to professionals out in the field, particularly healthcare professionals, but all sorts of professionals. I run a caregiver support group that normally meets in Brooklyn, but we're having it virtually, of course, right now. And I also meet with families one-on-one, primarily Brooklyn and Staten Island, but really throughout New York City. And of course, we're doing that virtually for the time being. So without further ado, everyone, I'd love to get started with COVID-19 and caregiving. So this is our agenda for today, 3 parts. We're going to talk about the connection between COVID-19 and dementia. I'll provide some tips and some strategies for caregivers. And then last but not least, we'll talk about resources that are available through the Alzheimer's Association. So let's start by talking about the connection between COVID-19 and dementia. We think of the word dementia, and I usually am out in the community providing all of our programs and services. So I always make sure that we all are aware of the term dementia, the term Alzheimer's disease. Dementia, we think of it as a large umbrella term. That's how I like to think of it. So under that umbrella term of dementia, we have many different forms of it that exist. Alzheimer's disease being the most common form of dementia. Between 60 and 80% of individuals living with dementia have Alzheimer's disease, but we know of many other forms of dementia that exist. Things like Lewy body dementia, vascular dementia, Parkinsonism dementia, frontotemporal lobar degeneration, just to name a few. So we know of over 100 different forms of dementia that currently exist. I'm not going to be talking about those different forms of dementia in this program. Today, we have Understanding Alzheimer's and Dementia, where we do that, but really important just to have that as our understanding. So we think of the connection between COVID-19 and dementia, and here's what we know. We know that most likely dementia does not increase risk for COVID-19. So no one-to-one causal connection between the two. But here's where we pay attention to, and here's what we know. We know that dementia-related behaviors, and we have a program devoted to talking about dementia-related behaviors, things like anxiety, agitation, restlessness, wandering, these types of things we know are in fact connected to COVID-19. So really, really important. So we as caregivers, and I was a caregiver for my grandmother who had Alzheimer's disease. So we as caregivers want to make sure that we're doing everything we can to lower the likelihood of the person having these behavioral changes. Really, really important. We know that people living with dementia may forget to wash their hands or take other precautions to prevent illness. So we're going to really focus on providing visual cues, auditory cues, tactile cues to really help the person. And we know that COVID-19 may actually worsen cognitive impairment due to dementia. So if you go to our website, alz.org, we've actually developed a section on COVID-19. So alz.org/COVID-19. You go on there, this is the information you'll find. You'll see some tips for dementia caregivers, especially as it pertains to COVID-19. We're going to talk a lot about a lot of these things today, but some of them I won't have an opportunity to get to. So I urge you to look at that whenever possible. And then on the right-hand side of the screen, these are our fact sheets, our topic sheets that we have. A lot of valuable, wonderful information that we discuss in those topic sheets. So let's start off by really looking at some tips and some strategies for caregivers of those individuals with dementia who are living at home. Really, really important. We want to make sure that we're following CDC guidelines, the Centers for Disease Control and Prevention. They're the governing organization related to health, and they're putting forth the guidance that we're all paying attention to these days. We recognize that individuals living with dementia may need support to remember important practices surrounding hygiene. Really, really important. So even prior to COVID-19, we do everything we can to remind individuals living with dementia about hygiene, the different practices we want to make sure we're doing. But now, especially with COVID-19, they might be more disoriented. So it's really important for us to do these things. So we want to start off by placing visual cues, signs around the house to remind the individual living with dementia to wash their hands with soap for a minimum of 20 seconds, right? That's the guidance from the CDC. So we want to put signs to help remind the person about that. Really, really important. I'm always monitoring them. I'm monitoring their reaction to things. So after I put those signs, I'm going to look to see if they're able to do that. If I'm noticing some hesitation or some difficulty with that, what I'll do is I'll actually demonstrate thorough hand washing. So tactile cue, really, really important. So I'll say, you know, Mary, let me demonstrate this for you, and we'll work on this together. I use the palm of my hand because our palm has a lot of nerve endings. So the person living with dementia tends to respond really well to that. Hand to hand, I embrace their hand, their palm and my palm. We call that hand to hand. Really important, and they tend to respond well to that. And after I've done all of these things, if I'm still noticing that my loved one isn't responding, maybe they're just not in the mood, it happens. It's really important at some point to really recognize that I don't want to create a tense situation. You know, we want to pick our battles sometimes. Really, really important to think about that. So at the end of the day, if I see my loved one is not doing this, I just want to make sure I have hand sanitizer in the house. Minimum of 60% isopropyl alcohol. That's an alternative. If I see that they're not using soap and water, I've tried all of these different visual cues, auditory cues, tactile cues. If they're still not responding, okay, fine, I'm going to pick my battle that day. It's fine. I have the hand sanitizer, and that's a good alternative. Some other tips and strategies for caregivers living at home. We want to monitor their health at all times. Really, really important, even prior to COVID. This is something we always want to do with individuals living with dementia, especially now with COVID-19. There's added stress, there's added confusion. So I'm monitoring for these things. If I see any changes taking place, and we know that dementia, unfortunately, is irreversible and progressive, meaning it gets worse and worse. So that baseline is going to change. But let's say we've noticed that our loved one is, functioning at a certain level for the past month or so. Now I'm noticing changes. I want to talk to the doctor about that. Really, really important. We also know that we can request prescriptions for medication for a greater number of days. So when I think back to the start of the pandemic in March of last year, March and April, the height of the pandemic in New York State, a lot of pharmacies, most of them actually, were allowing prescriptions to be filled for a greater number of days. Why is that important? Well, it limits the amount of times the individual is heading outside, therefore limiting the likelihood of them being exposed to the disease. The trends are moving in the right direction in New York State. Happy to see that. Hope that continues. We have to remain vigilant for the foreseeable future, but a lot of pharmacies are still doing this. So I would contact the pharmacy and check in with them. We want to make alternative plans for adult daycare, respite, other community-based services and services that are available. And then this last point is really, really important and goes to the point that we always make, that the borough president made in the video. We want to monitor our own health. Caregivers are at the forefront of this. So if we're seeing that we're not feeling well, we want to make alternative plans. So those are the tips and strategies for caregivers of those individuals living with dementia at home. I'm going to shift gears a little bit and talk about those individuals with dementia who are living in care facilities, things like long-term care facilities, nursing homes, assisted living, retirement communities, and we're going to talk about some tips and strategies in those situations. So we want to check with the facility regarding procedures for managing COVID-19 risk. What policies, what protocols do they have in place? They have to make that publicly available. Really, really important point. At the start of the pandemic last year in March and April, that information wasn't really available. We, as the Alzheimer's Association, were at the forefront of mandating that that information is publicly available. They are required to produce that now. We want to ensure that the facility has multiple emergency contacts in case of an emergency. We want to continue monitoring our own health. And if we're noticing that we're having signs or symptoms of illness, we want to make sure we're not visiting that day until we feel better. If we're unable to visit due to illness, or if the facility is locked down, hope we don't have more of those coming. But when I think back to March and April of last year, when the facilities were locked down, we want to really talk to individuals, to staff in the facility, and we want to ask them how they maintain contact with the individual living with dementia. Some important considerations that we want to think about for residential facilities. If we are maintaining the person, our loved one, in the facility, we want to think about a variety of different things. We want to ask the facility about their quarantine procedures, what policies, what protocols do they have in place. They have to produce that information. We want to think about what is our level of confidence that CDC guidelines are being followed. We want to think about and ask, and they have to produce this information. We want to know how many people in the facility have been impacted by COVID-19. staff, residents, and both staff and residents, and they have to produce that information. We want to think about whether or not our family member is able to follow social distancing procedures with or without help. Really important. I mentioned that I run a caregiver support group that typically meets in Brooklyn. We're now having it virtually, of course. I have a woman who participates in the group. She's caring for her mother who has dementia, is 103 years old, and she's in a care facility. And this was one of the considerations that she had to make, whether or not she felt her mother could actually follow social distancing procedures. Really important consideration. We want to think about whether or not the facility has personal protective equipment, PPE, face shields, masks, those types of things. We want to think about that. We also want to think about how many staff members interact with our family member on a regular basis, and whether or not the facility is able to limit this number. Really, really important. It's a balancing act. That's how I always describe it to individuals. So we absolutely want to make sure that our loved one is getting the help that he or she needs. That's of paramount importance, of course. But we also want to make sure there aren't too many people involved with care, because the more people that are involved with care, the likelihood of them having COVID increases. So, and they can, God forbid, then transmit this to our loved ones. So we want to make sure there's a balancing act. And we also want to think about whether or not the facility is adequately staffed to provide the level of care required. And when we think about all of these things, one thing we want to recognize that's really, really important is that unfortunately there's no simple answer. There's no one way to completely eliminate risk. Risk will be there, and it's a difficult realization, and one that we're having to grapple with. We do everything we can to mitigate the risk, to lower the likelihood of contracting COVID, but we recognize that no matter how much we do, until the pandemic is really over, there's really no way to completely eliminate the risk. Let's say we're considering moving our loved one to another facility. We want to think about a few things in that situation as well. We want to recognize that there's no way to know whether the new facility will remain free of COVID cases. We want to ask about whether or not the facility is accepting new residents, right? Very important to think about that. Have there been COVID-19 cases in the new facility? And they have to make that available to us. They have to make that information available to us. And then last but certainly not least, we're asking a lot of the same questions that we talked about in the previous slide, maintaining the person in the facility. We want to think about staffing. We want to think about policies, procedures, and protocols that are in place by the facility. And again, no simple solution. And in the dementia world in general, even without COVID-19, that's something I talk to caregivers a lot about, is the fact that there's no one-size-fits-all approach with regard to dementia care. We want to mitigate risk. We want to, of course, lower the likelihood of our loved one contracting COVID-19. But I also want to think about interaction, human interaction. Isolation is a real problem right now, even without COVID-19, but even more so with COVID-19. So maybe if I do everything I can to limit exposure, but I know my loved one, right? Person-centered care. And I know how important it is for my loved one to interact with others. Maybe that human interaction, I'll do that because it's so important to them. Really, really important to think about things holistically. If we are considering moving a person home, we have a few considerations we want to think about. What level of care does the person need on a day-to-day basis? So really making an honest, as best we can, an honest assessment of what kind of care our loved one needs and requires. Are we in a position to provide that care at home? we're always looking at things through the lens of where can my loved one get the optimal and the best care? And if I make a determination that, I can't do that at home, then maybe that's not the best decision. We really want to think about where they can get the best care possible. Lots of considerations to think about with that as well. So are we able to provide the level of care needed? Trying to, again, think about things holistically. Am I the only caregiver? If I'm the only caregiver for my loved one with dementia, the burden is going to be all on me. Do I have support? If I don't have friends or family, reaching out to members, to individuals in organizations I'm a part of. A lot of people tend to forget about that. The sphere of influence. Where can we look for support? If I am spiritual, if I am devout and I go to synagogue or I go to church, mosque, whatever the case may be, reaching out to people there, they can provide support that's so important. We also want to assess for the number of people needed to provide adequate care, while also limiting the number of people who have contact with the individual with dementia. I mentioned this a few moments ago. It's a balancing act. I want to absolutely make sure that there are enough people providing care for my loved one that's of paramount importance. But I also recognize that while we are in the pandemic, any extra person that's involved in direct one-on-one care, the likelihood of my loved one contracting COVID increases. So having enough people provide care, but not having too many people. We also want to think about whether or not anyone in our family has COVID-19 or is showing possible symptoms. Really, really important to think about that as well. Are there individuals in the home who work outside the home? Really important as well. That's going to affect my decision about where my loved one can get the best care. Because if I know that, well, let's say I have 3 caregivers at home, myself and 2 other family members, and let's say 2 of us or 3 of us are working from home. Well, because we're working from home, the likelihood of us having COVID-19 is less. So that's going to affect my decision. If the situation is different, if it's me and 2 other caregivers and all of us or almost all of us are commuting to work, well, on account of that, the likelihood of us developing COVID is higher. So that's going to affect my decision. And then last but not least, we want to think about whether or not we need to hire home care workers, home health aides. A few notes on that, on in-home care providers. One thing we absolutely want to make sure that we're doing is we want to do a temperature check prior to them entering the home. 100.4 degrees Fahrenheit, that's the magic number. So our normal body temperature is 98.6 degrees Fahrenheit. We have a little bit of wiggle room between 98.6 and 100.4, but 100.4 is the magic number. So if the home care provider comes, if the home health aide comes to the house one day, I politely ask him or her, I take a temperature. And if I see it's 100 degrees, 100.4 degrees or higher, I politely tell them, you seem to be running a fever, you have an elevated temperature, and out of an abundance of caution, I ask that you not come in today. Nothing wrong with that. We also want to check with the agency on their ability to follow CDC guidelines. Are they following through with that? Last summer, around June or July or so, I was working with a family, and the husband is a caregiver for his wife. He actually contacted the agency because he had a feeling they're not following CDC guidelines in the home care agency. Turns out that he was right. So we want to make sure we're doing that. We want to ask if the person has been exposed to anyone with COVID-19. That information is vital. And then this last point, really, really important, last but not least, we ask them to wear a mask, right? We know that things in New York State, hopefully, are moving in the right direction, but we have to remain vigilant. There's something called herd immunity in epidemiology. So until a large percent of our communities are vaccinated, individuals in our community are vaccinated, the disease still poses a threat. So we have to remain vigilant. We recognize that the incubation period with the disease, I think the guidance has changed a little bit. It was, I think, up to 14 days. Now, I believe the last time I heard it was around 7 days. But for 4, 5, 6 days, a person might have been exposed to COVID, but they don't know it because they feel fine. They're walking around, they feel perfectly fine. So the mask is the best weapon we have right now. We put the mask on because we might be asymptomatic. We were exposed to COVID-19, but we don't know we were exposed. And in that period where we don't know, when we feel fine, we inadvertently expose others to the virus. So, we have to continue wearing a mask for now. And we also want to practice social distancing, 6 feet, because the science tells us that that's how we limit the spread of the disease. All right, a lot of material that we discussed so far. And before I shift gears to a topic that's near and dear to my heart, activities and person-centered care, I think this is a great opportunity to see if anyone has any questions, comments, thoughts. I'd love to hear from you. No? All right. Well, there's going to be an opportunity for questions at the very end. So moving on, let's talk about activities at home. We actually have a portion of our website devoted to this, alz.org/care. So activities are really, really important. And I can't stress that enough. So it helps the person with dementia stay engaged, active. It offsets a lot of the behavioral changes that we see with dementia, things like anxiety, things like agitation, confusion, restlessness, understimulation, and boredom. So a lot of times, and it breaks my heart as someone who works in this field, but first and foremost, as someone who was a caregiver for my grandmother, a lot of times I see long-term care facilities have the individual with dementia seated in the same seat for 6, 7, 8 hours. Let's think about that. Who can sit in the same spot for 6, 7 hours? We're able to express everything, but individuals with dementia, unfortunately, are losing that awareness and that ability to communicate. So we have to be their biggest advocates and monitor these things and keep them engaged. Activities are a wonderful way of doing that. So we want to try to create a simple daily plan. So we actually have an example of that on the far right portion of the screen, a sample daily plan for morning, afternoon, evening. That's great. I would actually probably be a little more specific. I would actually get a whiteboard or something along those lines using a dark colored marker, purple, brown, red. The reason for that is because individuals with dementia, as the disease progresses, their ability to distinguish lighter colors is deteriorating, unfortunately. So we want to try to use darker colors, but really have a sample plan, daily plan. Wednesday, March 10th, 2021, 9 a.m., 10 a.m., 11 a.m., so forth, writing down what we're going to do. Keeping it at eye level helps orient the person, helps keep them engaged, which offsets a lot of the behavioral symptoms and changes that we see. Something else it does is it helps avoid repetition or repetitive behavior. We know that's one of the classic signs of dementia, one of the first signs, because of the involvement of the hippocampus, part of the brain that stores short-term memory. So when they see that, that helps orient them. We want to keep their skills and abilities in mind. Really, really important. So I'm choosing activities, but I'm not choosing them at random. I'm thinking about my loved one. What have they always enjoyed? What are some of the activities they've always loved? Because one of the things we know is that even in the late stage of the disease, the person's intrinsic wants, desires, likes, dislikes are still there. And that doesn't change. right, as the disease progresses. That's actually a big misconception about dementia, is that the person is entirely lost to the disease and that they lose interest for things they liked before. That's simply not true. So whenever I meet with families, one of the first things I always ask them, before the signs, before the symptoms, I usually tell them, that's important. I absolutely want to hear about that. But first, tell me about your husband. Tell me about your wife. Tell me about your grandmother, your mother. I want to know them as a person, their likes, their dislikes, their personal history, elements of their life, their biography. These things are really, really important in the dementia world. We want to focus on enjoyment, not achievement in the dementia world. We don't really care if the task or if the activity is actually achieved 100%. I'm living for the moment where my loved one is just enjoying the moment. We're building a connection, a moment in time, and that's the key. Not so much whether it gets achieved or not, but whether or not they're enjoying the moment. And then last but not least, with everything, especially with everything going on right now in the world, we want to be mindful of exposure to upsetting content. Anything on the news, TV shows, movies, things that have upsetting or disturbing content. The person with dementia is losing awareness of things around them, things that are taking place. And it's really, really important to kind of limit that upsetting content that they're seeing, especially because individuals with dementia can't distinguish fact from fiction a lot of times. So we want to be cognizant of that. All right, something else that's really, really important, caregiver stress, something we absolutely want to think about. I love that video by Eric Adams, the Brooklyn Borough President, really, really important. You know, caregiver stress is something we have to address and something we want to think about. It affects caregivers mentally, physically, emotionally. We have to practice self-care. We have to find time to take care of ourselves. I run a caregiver support group, and I always finish the group every month. The last 10 to 15 minutes that we meet, I ask the caregivers to tell me, what are you doing to make sure you're not stressed? Are you practicing self-care? Tell me one thing you have done the past month. We meet once a month. Tell me one thing you've done the past month to alleviate stress. So whatever those things that you enjoy are, doesn't matter what you're doing, as long as it's something meaningful to you, right? So physical activity can be one thing, so important, especially because it's connected to heart health. We also know that heart health is connected to brain health. What's good for the heart is good for the brain. What's bad for the heart, unfortunately, is bad for the brain. So trying to get exercise. COVID-19, I was just talking to a friend of mine about this the other day. I feel that COVID-19 has changed our lifestyles in so many ways. We're more sedentary. We're not moving as much. I'm guilty of that. So I'm trying to find time in this virtual world we're living in right now. I'm trying to find time to go outside and just go for a walk. Something simple like that is going to be really important. We want to stay connected again. Isolation, especially now with COVID-19, is an important consideration to think about. So I always tell people, you know, just pick up the phone, 5 minutes, 10 minutes, and call your loved one, call a friend, call a family member. Stay engaged that way instead of this virtual environment. Just a phone call like that. If you can, you know, goes back to mitigating risk. If you feel you can, because you're healthy and you're managing your health, maybe putting on a mask and visiting a friend. Really, really important to think about that. Asking for help and support is going to be really, really important. It can be a barrier a lot of times. Feelings of guilt, shame. I'm a bad caregiver because I need to ask for help. That's not true. It doesn't come from a place of weakness. By asking for help, you're acknowledging that I cannot do this alone. And no one in the dementia world, if you talk to most caregivers, past, present, they'll say you can't do this by yourself. So really, really important. I can tell you that from personal experience. I have a small family. I remember caring for my grandmother. You need the help. We need the help. And there should be no shame in asking for that. The analogy I always like to give when we're on a plane, flying somewhere, not really flying these days for now, unfortunately, but when we are on a plane, the flight attendant does that safety demonstration. What do they tell us? They say, put the oxygen mask on yourself first, and then put it on the person next to you. Same type of concept. We want to think about relaxation techniques. What is meaningful to us? What can we do to relax? So for me personally, I always love being outdoors, particularly by the water. So I find time to do that as best I can. I put on a mask, I practice social distancing, but I go outside, especially now with the weather getting warmer, the spring coming up, really, really important. That can be something you can do. Something else that is really meaningful for me personally, music. So what I do now, for the past year, I've been doing this ever since we started working remotely. I actually listen to a little bit of music at the start of my day and then at the end of the day. Whatever works for you, as long as you're incorporating that. We want to make sure that we're accessing resources available through the Alzheimer's Association, through other community-based organizations. I work with PSS a lot. So, they provide so many wonderful services, really just making sure we access those resources. And then support groups, whether it's through us at the Alzheimer's Association or other organizations, really, really important to help alleviate that stress. And then on the right-hand side of the screen, the 10 symptoms of caregiver stress, we want to make sure we're paying attention to them. Doesn't have to be all of them, could be a few of them. It's usually not all of them, but we want to make sure we're monitoring them. Cortisol, the stress hormone, builds up when we're stressed. Stress is cumulative. It adds up and gets worse and worse over time, and affects it affects us physically and mentally. So really important to think about that and to recognize that we're here with you at every step of the way to provide support. If nothing else, we're here to provide emotional support. Can't tell you how many times I meet with families, I talk to families, and they just need to talk, and that's perfectly understandable. So we want to be able to do that. So we're here with you at every step of the way. This is our mission and our vision, what we're striving to do every day. We are the world's leading voluntary health organization in Alzheimer's care, support, and research. We accomplish this by using a multifaceted approach. I call it the 3 C's: care, cause, cure. I have the honor and privilege of being part of the program team in New York City. So we're on the care side of things. We educate and support families, and we train professionals in best practices of dementia care. That's one of the major reasons why I go out in the community and do trainings for professionals, and my colleagues do the same thing. Cause, the cause component, we raise awareness and we drive public policy, and we advocate for increased research funding. And then cure, we fund leading research and we facilitate global collaboration. So let's talk more about each of these things. The care component, we have virtual programs. So if you go to our website, alz.org, or our New York City website, which is alz.org/NYC, you'll see all of our education programs there that you can participate in. And of course, last March, actually exactly 1 year ago, I think, we transitioned to virtual delivery of our programs and services during the pandemic. We have online information in many languages: Spanish, Chinese, French, and Korean. We also offer an interactive video brain tour in 15 languages. I personally love science, probably in the minority on that one, but this interactive video brain tour is amazing. It actually shows you the changes that take place in the brain, and we have that in 15 different languages. And then alz.org/global is a portion of our website where we talk about everything that's taking place around the world in the research space and in the care and support space. So we provide education programs. They're free, just like all of our programs and services. Those are the topics that we talk about. We provide help for caregivers, of course. You can meet with myself or anyone else on the team. We'll help create an action plan. We'll talk to you and help in your with your unique situation. We know that every caregiving situation is different and unique, so that's really important. Of course, we provide help for people living with dementia. They can meet with myself, anyone else on the team. We'll help create an action plan. And we have early stage programs, and I mentioned that early on, our support groups and our social engagement activities. Medical Alert is another core service that we provide. It's a 24-hour emergency response system that provides help in finding a person living with dementia who has wandered. We know that 60% of individuals with dementia will wander at some point in the disease process. No way of knowing if and when it will happen, so we want to be prepared. The person can fill out an application, and then they get this jewelry. This gentleman, you see he's wearing this bracelet. It says that they're signed up in the program, says that they have dementia, lists any allergies that they might have, and if God forbid they wander, hopefully they're returned home safely. And we as an organization nationally are in the process of training first responders to recognize this as dementia so that they know to react and to respond differently, that this is not a law enforcement issue. It's an issue that it's a disease, and we want them to respond accordingly. All's Connected is a resource we have online. It's a free online community for everyone affected by Alzheimer's or other forms of dementia, so they can connect, learn from one another, talk to one another. That's one of the best ways of building your support system. The Alzheimer's Navigator, another tool we have online. It helps caregivers. They'll answer a few questions and they get a customized, personalized action plan that connects you to information, support, and resources. We are an information and referral-based organization, so you can contact myself, you can contact the helpline, and we'll get a list of neurologists, lawyers, adult daycare programs. We connect people to other agencies, organizations to help make this journey a little more manageable. So you can contact the helpline, or you can contact me and say, hey, you know, Greg, I'm looking for a list of doctors in my neighborhood. Can you help me out? Our helpline, I mentioned it, it's available 24/7. 200 languages that they provide assistance with through their translation services that they have available. Here in New York City, on our program team, we speak different languages to make sure we're really affecting all parts of New York City. So I speak Russian fluently. My colleague speaks Chinese. I have another colleague who speaks Spanish, to really make sure we're providing assistance in languages that people are comfortable with. Public policy and advocacy, I'll make a note on this. You know, we advocate at the federal, local, and state level for people living with the disease and caregivers. We are bipartisan and we are nonpartisan, and I always mention that. So we have no political agenda. We talk to Republicans, we talk to Democrats, independents, lots of bipartisan support for the work we're doing, which is tremendous, especially in this hyper-partisan world that we're living in. Trial Match is the research arm of our organization. Signing up takes a few moments. You can do it online. You can call our helpline. You answer a few questions, and you'll get a list of studies that you might be eligible for. If you see a study you're interested in, you then contact the PI, the principal investigator, and you can sign up, learn more information, and sign up if you're interested in lots of different studies, clinical studies, but a lot of behavioral studies as well. And we're looking for individuals who are healthy, individuals who have the disease, people of different ages, backgrounds, really, really important to help us find the cure. We're the largest nonprofit funder of research worldwide, and we're right behind the United States government and the Chinese government in terms of funding research. Next generation is a specific way in which we're doing that. We're funding research, convening researchers, and we're advancing systems that support breakthroughs. And that's it for my program today. I want to thank you all so very much for joining me. Always a great honor and privilege to be able to do this. I urge you to join the fight, get informed, speak up, help out. We're all in this together. I feel free to reach out to me at any time. And with that said, I'd love to open it up to questions, comments, thoughts that any of you might have. Thank you all so very much.
Thank you again, Greg. We do have some questions. Somebody asks, do you know anything about the time frame for opening our facility for visitation?
I do not, unfortunately. I know there's been guidance recently from Governor Cuomo here in New York State, but I know in talking to a lot of different facilities and staff there, it's a process. So I would just reach out and ask them what phase of reopening they're in.
Yeah, I learned about that also. So some places has their guidance. They follow the state guidance. I will suggest to go to NYC Gov also to see any information there.
Exactly.
Do you know any agency also providing information about cerebral palsy? Or if your agency provide that?
We do not. We provide help and support for all forms of dementia. I do not know if there's an organization that provides support for cerebral palsy. Off the top of my head, I do not. I'm sorry. I imagine there must be. I imagine there is, but I just don't know of one.
Yeah, I can't think of one, but we do have a list of resources. I can see her name, Martine. So I think I will just, if you reach out to me, maybe I can go back to the list of resources that I have. I can probably provide any information regarding that. Do you offer in-home doctor services name looking for ENT?
So we're information and referral. That's a great question. So we will link you and we will connect you in much the same way that Shayna just said it. So feel free to reach out to Shayna, to PSS, to us, similar thing. We will link and connect you to any service. And I'll also provide my contact information in the chat.
Yeah. Yes, you can put it in there.
So, yeah.
Any other questions? Again, if you miss any part of it, or if you think somebody might be interested about these information, please share the link. I'll add the link on the chat. So, or you can just visit at pssusa.org/resources. You'll see all the past event that we had and the one, and also pssusa.org/event. So you'll see all the upcoming one. So again, Gregory, thank you for today. And we want to thank again the Brooklyn Borough President for creating this initiative to provide important topics to the community. So I'll see everybody next week for our next session of Wellness Wednesday. If any other question, wait, where is the person looking for? If the person looking for a CP in its white borough, what's CP? I'm not sure what does that mean.
The cerebral palsy, I think they mean.
Okay.
Yeah. So someone seems to have connections and
okay.
On that front.
Oh, so, thank you, Linda. Please, if you do, you can just share it with me and I'll share it with everybody.
Yeah.
Okay. Thank you again, and have a great afternoon, everybody.
Thank you, everyone. Take care. Be well.
Bye-bye. You too. Bye.